Hello everyone, my name is Mohit Deshmukh. I am a second year MBBS student from DUPMC Jalgaon and my topic is Advancement in Drug Treatment for Bronchial Asthma. The topics that I am going to cover include sympathomimetic drugs, methylxanthines, theophylline, anticholinergic drugs, leukotriene antagonists, corticosteroids and choice of treatment. Drugs for bronchial asthma. Bronchial asthma is a chronic respiratory condition that requires effective drug treatment to manage symptoms and improve quality of life. Drugs for bronchial asthma include bronchodilators such as beta-2 sympathomimetic such as salbutamol, terbutaline, methylxanthine such as theophylline and aminophylline, anticholinergics such as ipratropium bromide and tiotropium bromide, leukotriene antagonists such as montelukast, zafirlukast, mast cell stabilizers such as sodium chromoglycate, corticosteroids which include systemic as well as inhalational corticosteroids such as hydrocortisone and inhalational include bicyclomethasone dipropionate, anti-IgE antibody such as omalizumab. Sympathomimetic drugs such as beta agonists are commonly used in bronchial asthma treatment to relieve bronchospasm and improve breathing. They work by stimulating beta receptors in the airways, resulting in bronchodilation and reduced inflammation. Methylxanthines. Mechanism of action. Methylxanthines, including theophylline, work by relaxing the smooth muscles in the airways and inhibiting inflammatory mediators. This helps to improve airflow and reduce asthma symptoms. Benefits. Methylxanthines provide long-term control of asthma symptoms and especially helpful in patients with nocturnal asthma symptoms. Side effects. Common side effects of methylxanthines include gastrointestinal disturbances, insomnia, and palpitations. Monitoring blood levels is important to ensure therapeutic efficacy and prevent toxicity. Considerations for use. Methylxanthines should be used with caution in patients with underlying cardiac conditions or liver diseases. Dosage adjustments may be necessary in these patients. Theophylline. Mechanism of theophylline. Bronchodilation. Theophylline works directly on smooth muscles of airways, causing relaxation and bronchodilation. This helps to improve breathing and reduce asthma symptoms. Anti-inflammatory effects. In addition to its bronchodilator effect, theophylline also has anti-inflammatory properties. It inhibits the release of inflammatory mediators, reducing airway inflammation and improving asthma control. Anticholinergic drugs. Overview of anticholinergic drugs. Mechanism of action. Anticholinergic drugs such as ipratropium bromide work by blocking the action of acetylcholine, a neurotransmitter that causes bronchoconstriction. By blocking these receptors, anticholinergic help to relax the airway smooth muscles and improve airflow. Benefits. Anticholinergic drugs provide additional bronchodilation and can be used in combination with other bronchodilators such as beta agonists for enhanced therapeutic effect. Side effects. Common side effects of anticholinergic drugs include dry mouth, urinary retention, and blurred vision. These effects are usually mild and temporary. Considerations for use. Anticholinergic drugs should be used with cautions in patients with history of narrow angle glaucoma or urinary retention. Regular monitoring is necessary to assess treatment response and adjust dosage if needed. Leukotriene antagonists. Mechanism of action. Leukotriene antagonists such as montelukast work by blocking the action of leukotrienes, which are inflammatory mediators involved in bronchoconstriction and airway inflammation. By inhibiting leukotrienes, these drugs help to reduce inflammation and improve asthma control. Benefits. Leukotriene agonists are especially beneficial in patients with allergic asthma or exercise-induced bronchoconstriction. They provide long-term control and symptom relief. Side effects. Common side effects of leukotriene antagonists include headache, gastrointestinal disturbances, and mood changes. These effects are usually mild and transient. Considerations for use. Leukotriene antagonists can be used as monotherapy or in combination with other asthma medications such as inhaled corticosteroids. Regular monitoring is important to assess treatment response and adjust dosage if needed. Corticosteroids. Mechanism of action. Corticosteroids such as fluticasone work by reducing airway inflammation and suppressing the immune response. They inhibit the release of inflammatory mediators and help to control asthma symptoms. Benefits: corticosteroids are highly effective in reducing airway inflammation and providing long-term control of asthma symptoms. They are the mainstay of treatment for moderate to severe persistent asthma. Side effects: systemic corticosteroids can have side effects such as adrenal suppression, osteoporosis, and increased susceptibility to infections. However, the use of inhaled corticosteroids is associated with fewer systemic side effects and is considered safe when used as directed. Considerations for use: corticosteroids should be used at lowest effective dose and for shortest duration possible to minimize the risk of side effects. Regular monitoring of lung function and systemic markers is important to assess treatment response and adjust therapy. Choice of treatment: the choice of asthma treatment depends on several factors including severity of symptoms, frequency of exacerbations, and individual patient characteristics. It is important to consider personalized treatment plans that address both symptom control and long-term management. MCQ questions: which of the following short-acting bronchodilator commonly used as a rescue medication for acute asthma attacks? The correct answer is A. Albuterol. Second, which class of drug is often prescribed as a long-term controller medication for managing chronic asthma? The correct option is B. Inhaled corticosteroids. What is primary mechanism of inhaled corticosteroid in the treatment of asthma? The correct option is B. Reduction of airway inflammation. Which of the following medication is a leukotriene receptor antagonist used to manage asthma? The correct option is C. Montelukast. Fifth, long-acting beta agonists are often combined with inhaled corticosteroids to provide better asthma control. Which of the following is an example of LABA? The correct option is C. Formoterol. Thank you.